Now, there are a few things about this current phase of the pandemic, and that is the incredibly high numbers. We had, 1,600 and something yesterday, but we expect a lag in reporting because of the weekend and so on. So I'm wondering, given that you gave what has been described as a stark briefing to the Cabinet on Tuesday, what exactly are the numbers that we need to reach before we start doing more things, more restrictions, perhaps, heaven help us, another lockdown?
So I did give a stark update to the COVID committee. Let me just give you a few of the facts that I shared with Cabinet colleagues. I think the one that really stands out for me, Pat, is last week was the fourth highest week of COVID cases since the pandemic arrived. The only 3 weeks where we had more cases than last week were the 3 worst weeks in January.
Now why would anyone open up nightclubs against that background?
Because of the vaccines. The only reason, Pat, we are able to continue to open up society, open up the economy, is because of the vaccines. So, and this is why it is so important that there is full compliance from the sector and from people going into the nightclubs. The absolutely clear understanding is the only people going into a bar or a restaurant or a nightclub are those who are fully vaccinated.
Yeah, and you depend on the proprietors to enforce that, and some are doing it very well and perhaps some not. But I was looking at the criteria from the WHO in terms of when you should adjust public health and social measures, and it says 1, epidemiology, is the epidemic controlled, yes or no? Well, no is quite clearly the answer there. Health system, is the health system able to cope with the resurgence of COVID-19 cases that may arise after adapting some measures? Well, at the moment, we heard from Paul Reid this morning that 6 of the healthcare groups are cancelling electives. So we're not coping. And the third one is public health surveillance. Is it adequate? We know that a couple of weeks ago you stopped contact tracing in schools. And yet, I think it was yesterday we were told that the 5 to 12-year-olds are being massively infected proportionately. So, this guidance came out last May.
I think what that says, Pat, it reflects the current situation, that the current situation is serious. We have a steep rise in cases. Our 14-day rate is at nearly 600 per 100,000. For me, worryingly, the question is, what is the translation into people who are getting very sick, right? So we have about 500 people in hospital. Now, here's what's equally worrying. We've about 500 people in hospital with COVID right now. That's up by more than 20% on 1 week and up by more than 40% on 2 weeks. We've over 100 people in ICU now with COVID. About 60% of them are not fully vaccinated. There's a large proportion in hospital as well who are not fully vaccinated. So one of the most effective things we can do to protect our healthcare system, to make sure that we're not cancelling electives, is for the 7% of people who to date have chosen not to get vaccinated to get vaccinated. Why? They are themselves at very high risk given the current case rates. Therefore, they're putting their friends and their families at risks, and also because they massively disproportionately represent the number of people in hospital and ICU with COVID.
What are your thoughts on the anti-vax protests? We saw what happened to Minister Paschal Donohoe, who's on social media being harassed by anti-vaxxers, and this was on Merrion Street, a stone's throw from the door of his office, not a Garda in sight. Should the Garda come down harder on these anti-vax people?
So, protest and rigorous debate is essential in our democracy. I think we'd all accept that. The question is following someone down the street screaming abuse at them, is that acceptable? I don't believe it is. Protesting outside people's houses, which essentially is an attempt to intimidate people's families, I don't believe that has any place in our society. If people want to take a view that they don't believe in science, they don't believe in medicine, that's their right. But it has to be done in an appropriate way. And no, I don't believe a group of people screaming abuse at someone walking down the road is appropriate at all.
Now, there are obviously disparate groups of anti-vaxxers, but do you believe that they're all kind of, not believing the science, reading stuff that is nonsense and peddling it to others? Or are there some who just like the idea of protest and doing this kind of thing to subvert the state?
Yeah, look, I think there's probably both, right? I think that the second point is undoubtedly an element to it. Unfortunately, through social media, an awful lot of misinformation gets disseminated, and a lot of it looks very real. You know, I've been shown some of the videos of, you know, that are getting sent around largely to people in their 20s, maybe in their 30s, and people get spooked by this. They do get spooked by this stuff. And what I would say, and I've heard you say it many times, Pat, is just ignore the stuff you're being sent on social media. Look at the official channels. Look at gov.ie, the HSE, ECDC, the CDC. Look at the official sites.
But you're part of the global conspiracy.
Well, yeah, I hear you. Can I say, if we're wrapping up,
Sure.
Pat, can I say it's been great to get into this level of detail on rapid testing and vaccines and where we're at. If I have a message for all of your listeners, it's the following. We're doing incredibly well as a nation. We got ranked again this morning, you've probably seen it, by Bloomberg, at number one in the world in terms of resilience to COVID. Number one in the world. We've had one of the most successful vaccine programs anywhere in the earth. And the Irish people have been absolutely magnificent and continue to be magnificent, right? We're in a tough spot now. The cases are rising. The vaccine program continues. And the message from me, the message from Dr. Holohan and others is, we just need to do what we've done so well the whole time. We just need to tighten up a little bit again. We need to make sure we're wearing the masks, we're doing the hand washing, we're doing the hand sanitizing, we're doing the cough etiquette. For the 7% who haven't got vaccinated, it's so important to protect yourself, to protect people around you, and to protect our healthcare system, so that people who need urgent operations can get access to those beds, get access to that ICU. We've done incredibly well, and I just want to thank everyone for everything they've done and say we just need to keep going now and push this virus down in the coming weeks.
All right, we'll watch the numbers. And I didn't ask you the red line. Do you have a hospitalisation number or an ICU number that will tell you we've got to restrict?
No, we don't. But what I can tell you is that the modelling is quite sobering. So as of this morning, we're at 101 people in ICU. If we continue on the current trajectory, the modelling suggests that we could reach 150 to 200 in ICU. Again, the vast majority of those will be the small number of people who are unvaccinated. And at that point, and indeed we're there to some extent, but you have to cancel a lot of elective planned surgery and operations. So there's a lot of people who are waiting for procedures, who need those beds, or need those beds to be there in case of eventualities. But if we all do what we've done and what the country has done so well since the start of this pandemic, we can push this virus back down and protect people and protect our healthcare system.